Hi guys, I am Devanjan and today let's learn about parasitology, gastroenteritis. Okay, gastroenteritis caused by non-acid fast protozoas. There are many protozoa which cause gastroenteritis, but today we will learn about those one which are acid fast. Okay, so there are three acid fast protozoa which causes gastroenteritis. One is a ciliate, one is a amoeba, and one is a flagellate. Okay, the ciliate is Balantidium coli. Okay. The amoeba, everyone you have heard of, Entamoeba histolytica. Okay. The flagellate is Giardia lamblia. The individual diseases which they cause is basically Balantidia causes Balantidiasis. The Entamoeba causes entamoebiosis. Okay. Giardia causes giardiasis. These are all three basically gastroenteritis in some form or another. We will discuss them when we study the individual protozoas. Okay. The life cycle of all the three is same. That's why we will discuss them together. And the transmission is also same, which is transmission is fecal-oral route. Okay. You need to remember this. Let's do the life cycle. The life cycle of all the three is same again, which I said. So the first, the cyst enter human via contaminated food and water. Okay, you eat contaminated food and water, the cyst will enter inside you. And it will go to the intestine. Okay, go to intestine. The cyst go to intestine. Any food you eat will go to intestine. Similarly, the cyst contaminated with the food will also go. The food contaminated with the cyst will also go to the intestine. Okay, then the cyst rupture in the intestine. Cyst rupture to release trophozoite. Okay, cyst will rupture inside the intestine and it will release trophozoites. These trophozoites will multiply, and these will cause the disease. Okay, now all the trophozoites are multiplying and some of them will convert into cyst. Trophozoite convert to cyst. Okay, these cysts will shed in the stool sample. Shed in stool. Cyst. Okay, now these cysts will again contaminate food and water and the cycle will continue. Okay, this is the life cycle. It is same for all the three. Okay, one thing you need to remember is the infective form. Infective form is cyst over here. As I said in life cycle, see, the cyst is entering human via contaminated food and water. One thing is that any protozoa, actually most of the protozoa having two morphological form, which is trophozoite and cyst. Most of them, the cyst is the infective form in most cases. You can remember this, infective form, most cases. Okay. Next, let's do the diseases. First, we'll do Balantidiosis. Okay, it is caused by Balantidium coli. Okay. The clinical features are of that of gastroenteritis, okay, which is abdominal pain, fever, okay, vomit, dysentery. Okay, you need to remember this is dysentery, not diarrhea. Okay, and then we'll have the clinical lab diagnosis. We'll do stool examination. Okay, stool examination we will do. We will find the cyst and trophozoites in the stool. Microscopic examination we will do. Okay, treatment is tetracycline. You can also use metronidazole. Okay, next we'll do amoebiasis. Just a second. Caused by Entamoeba histolytica. Okay, clinical features which are there are actually clinical features are divided into three types. Okay, first is non-invasive intestinal amoebiasis. Okay, over here the patient actually does not have any clinical symptom, no clinical symptom. The patient is free of any symptom, but the cyst will be shed in the stool. Cyst shed in stool. These people are called cyst carrier. Now, why it is important to treat such patient? Because they will continue to contaminate the food and water, spreading the disease to other people. Okay. Next, the clinical feature is invasive intestinal amoebiasis. Okay. Invasive intestinal amoebiasis is basically again gastroenteritis. Okay, having fever, abdominal pain. Okay, and again dysentery. Okay, not diarrhea, dysentery, and also causes a flask shape ulcer. Okay, it also causes flask shape ulcer. Now, certain extraintestinal clinical features are also seen. Okay, these are basically abscesses. Abscesses are seen in, this you need to remember, lung, brain, sorry, the order is wrong, liver, lung, brain. Okay, most common is seen in liver, then lung, then in brain. Abscesses are seen, extraintestinal feature. This is sometimes comes on a short note in university exams. Okay, then we will do the morphological forms of amoebiasis. Okay, it is basically trophozoite. One is trophozoite. Okay, trophozoite, in the trophozoite of amoeba there is basically pseudopodia present. As it is an amoeba, there is pseudopodia which is present. Sometimes RBCs are seen in the in the cytoplasm in these amoeba. Okay, RBC may be seen in cytoplasm. Okay, it is not a compulsory thing. It is sometimes seen, sometimes not seen. Okay, next the morphological form is cyst. Okay, cyst is round shape plus 4 nuclei. Okay, next is lab diagnosis. Okay, the lab diagnosis, first we will do immunological, which is ELISA PCR, Okay, in the ELISA the lectin antibody is actually detected. Okay, there is also a rapid test. Okay, rapid test in where the surface antigen is detected. Okay, there is one more thing you need to remember. Zymodine, there is something called zymodine analysis. It helps to determine the strain. Okay, strain of the Entamoeba which is causing the disease. Okay, the strain is detected via zymodine analysis. Okay, and you can do imaging for the abscesses which is present. Okay, abscesses imaging is to be done. Okay, now comes the treatment. Okay, for non-invasive, which is basically having no clinical symptom, you can use parmomycin. Okay, for invasive, you can use metronidazole. Okay, for the abscess, we need to do surgery, plus we can use metronidazole. Surgery needs to be done for the abscesses. Okay, next we have giardiasis. Okay, caused by Giardia lamblia. Okay, first the clinical feature or clinical symptom, whatever. It is also gastroenteritis. Okay, gastroenteritis. Over here it is same, abdominal pain, fever, but you need to remember this causes diarrhea. Okay, not dysentery. It is causing diarrhea. Giardiasis causes diarrhea, not dysentery. Okay, Next coming the morphological forms. Okay, first is trophozoite. Trophozoite over here is badminton racket shape. The shape is just like a badminton racket. Okay, it has 8 flagella with 2 sucker plus 2 nuclei. You know to remember this. Okay, the characteristic thing about it is that an axostyle is present. It is a characteristic feature, okay, of the trophozoite, and also it is present in the cyst also. We'll discuss it. Okay, and the motility is falling leaf motility. Okay, and the next is the cyst. Cyst is oval shape with 2 nuclei. 4 nuclei. Okay, and again over here axostyle is present. So if you see axostyle under microscope, most probably it is Giardia. Okay, Giardia lamblia. Okay, next is lab diagnosis. Over here we'll do stool examination. Now one thing we need to remember, that Giardia is shed in the stool, but it is shed intermittently. It is shed intermittently. It means that the Giardia is not shed continuously. Means every time you do stool examination, you may not see Giardia. Means there is chances of false negative. Chance of negative. So you need to do the stool examination multiple times to confirm that the patient having, means if it is coming that stool examination is negative, you can't just rule out that it is not Giardiasis. Okay, you need to do it multiple times. Another thing you can do is gelatin string test, but it is time consuming. Okay, that's all for today. Next we'll do the acid fast protozoa causing gastroenteritis. Thank you.